It's hard to believe there are still places in the world without the imprint of civilization. For those in the Sepik region of Papua New Guinea, the availability of life-saving medical care is nearly impossible, except for one amphibious airplane.
So we're here at Timbunki on the Sepik River. There's a snake bite patient. She was bitten by a snake yesterday afternoon and is showing signs. Her tongue is swelling and she's having a hard time breathing and semi-conscious. So we're going to get her some anti-venom and hopefully save her life.
This is just one of hundreds of life-saving stories. But over 500,000 people remain without access or hope for medical emergencies that could result in death. This is Samaritan Aviation.
My name is Mark Palm. I'm the president of Samaritan Aviation, and I'm sitting here on East Sepik province of Papua New Guinea. Samaritan Aviation was started in 2000. And it began with a dream of myself and a friend who came over to Papua New Guinea in 1994. And while we were living on the islands with the local people, we saw a need for spiritual and for medical help and to bring the love of Christ to the people on the islands and also to the very remote areas. And the idea of bringing a plane that can land on the water and reach areas that were inaccessible.
After years of preparation and with the support of faithful partners back home, Samaritan Aviation was able to acquire a float plane, and having established a cooperative relationship with the PNG government, they began medical evacuation services in 2010.
My name is Jacob Carroll. I served as a board member for Samaritan for 15 years. We've been involved in most of the major villages up and down the river, and that's given us credibility that otherwise we would never have. When you save somebody's life, you get their ear, and you're able to tell them why you're doing what you're doing.
We have one hospital in this area for 500,000 people, and 80% of them are anywhere from 3 to 5 days away, some of them up to 2 weeks away from the only hospital that they have access to. That's where the float plane comes in. We have over 700 miles of river here on the Sepik River. We have a lot of small rivers that flow into the Sepik that we're able to land on, and we're able to service 37 aid posts and clinics along the Sepik River and basically provide access and hope for the people that can't get in.
I'm Kirsten Palm, and one of the things that I get to do with Samaritan Aviation is visit patients in the house sick. So when Mark gets a call for a life flight, he'll go out and pick up a patient, and then we'll have the opportunity to visit the patients here in the hospital and build relationships with them, and then we'll be able to share who Jesus is with them.
The mission of Samaritan Aviation is to serve both the physical and spiritual needs of the New Guinea people. The transition to the second phase will provide the additional capacity to focus on discipleship.
And so for us, it's about spending time with the locals, getting to know them, who they are, and really just pouring into them. Community health evangelism has also been one of our focuses. This basically is a holistic community development program that brings in health as well as spiritual concepts at the same time.
The focus of community development is to teach and empower the people to be self-sustaining and lessen their reliance on outside resources.
But we really haven't been able to focus on the discipleship training and the community development.
The problem that we've had is that we only have one plane, and that one plane has limitations. We have one plane and one pilot. Mark Palm has been there for 4 years, and he's had no backup. He's on 24/7. Whenever that phone rings, he has to go because somebody's life is on the line.
Whenever we have maintenance issues on the plane or need to order parts, the plane is down. And so when people call, we're not able to respond. The need is great. This was the busiest year we've ever had. As I look at our needs at Samaritan, we need another airplane, we need more families, we need a place for those families to live, and we also need a hangar for the aircraft.
Thankfully, the PNG government just helped us purchase our second airplane, but that's has to be retrofitted to fly on land and land on the rivers. There's a lot of things that have to go on with that airplane to get it ready for the air ambulance service that it's going to have in the CPIC.
Another airplane will double the capacity for life-saving efforts, but it also requires another missionary pilot.
I worked for the airlines for several years and as a pilot in corporate aviation. My wife Carrie and I and our 4 children, we served the last 2 years in Papua New Guinea. We knew that God had connected us with Samaritan, and we were very excited to be going back to Papua New Guinea to serve with my passion for evangelism and for flying together.
The team includes a community outreach coordinator and has recently welcomed a medical family that will also assist in the evangelism goals.
I'm super excited that we have 3 additional families that'll be joining us this year. So what that means is we have to have a place to put them. And that's where the compound comes in. And that's so important. If you come to a place like Papua New Guinea that's a bit dangerous, can be very volatile, it's important, number one, to have a safe place for families. And this compound will allow us to do that.
The property offers 5 living spaces and an office that will serve as the team's base of operations, but it requires a lot of remodeling to make it livable.
Right now we don't have a hangar. We borrow space from another missionary group, and there's not room for the second plane, so we have to have a second hangar. Papua New Guinea isn't a place where the airplanes can just sit outside.
The physical needs are necessary in order to fulfill the true purpose of Samaritan Aviation.
As these families come online and as we have the ability to spend the time in the village that we need to do the discipleship training and to be transforming communities, that's really what Samaritan Aviation has been called to do. But we're at a place right now in our organization where to get to the next level and to really go deep here in this area and to really have the impact we feel God has called us to, that it's going to take a significant amount of capital investment to help us with the airplane, to help us with the compound, to help us build a hangar, and to help us get our headquarters here in Papua New Guinea in a place where we can accept the families that God has called to come and join us. We really need you in America who believe in us and support us, and we can't do it without your partnership. And so I'm asking you to consider a donation. And so I just want to say thanks, and also say please continue to support us.